Atherosclerosis is a condition that involves the entire body, and it doesn't just cause hardening of the arteries, it actually causes blockages in the arteries. Not only can it cause blockages in the arteries, but in many people it actually causes what are called aneurysms. Aneurysms are actually ballooning of the arteries to the point where if the artery gets large enough, it can actually burst or rupture. A lot of patients don't have symptoms from it. We do educate our referring doctors to look for these and to screen for it in the high-risk patients because it is a very underdiagnosed condition. The way that this can be prevented is if it's detected, it can be treated with now a medical breakthrough called stent grafting, where we can actually go in with the help of a surgeon to place a device, kind of like a covered stent, a stent covered with special medical fabric that excludes the aneurysm, and it pretty much excludes the aneurysm from the rest of the circulation, so the blood doesn't need to go there. And so it naturally shrinks down and it disappears over time. This is a procedure that's actually done in the hospital. The patient would come in to the hospital. We would do it in a place that can allow us to look through the patient's body with x-rays. It's called an angiography suite. And we work with a surgeon who allows us to put the device through the groin arteries. It's done, the surgeon first creates an incision about 4 centimeters long in both groins, and he exposes the artery in the groin. That's what we use to put the device through both groins. It's a tube-like device that goes in both sides, and then it links up to form an upside-down Y. And then this device actually, once we release it, it opens up by itself at the right spot to cover the aneurysm and block it from the circulation. And then we are able to put the whole thing through this self-expanding device. Once it's opened up and it's formed inside the patient, we actually go ahead and have the surgeon close those punctures that we've made in the artery in a controlled fashion, and then the skin incisions are also closed. So you end up with about 4 centimeter length incisions in both groins, which the recovery from that is pretty quick. And patients stay overnight and they generally go home the next morning, and we just follow them up as outpatients. And this is very much in a contrast to the typical standard open surgical treatment where they have an incision involving their whole belly and involving the pelvis, and they stay in the hospital for many days afterwards. These treatments provide options for people who have either no options presented to them before or who have very limited options, and the treatments are generally faster, safer, and less expensive than the standard treatments that are available.